Hello everyone, welcome to our channel today. Today we're going to talk the last formula in heat cleansing formula for toxic condition, 清温败毒散. In the following videos, we're going to discuss the heat cleansing formula in different organs. So this formula is the last formula we're going to discuss in toxic. So this formula is the last formula we're going to discuss in toxic condition. 清温败毒散，清温败毒散，清温败毒散 is from 一整一德. It's actually originally is used for epidemic disease. Let's see the ingredients first. 石膏，生石膏，生地，犀角，黄连，栀子，桔梗，黄芩，知木，赤芍，玄参，连翘，甘草，丹皮，鲜竹叶. The main symptom of this formula is the patient have severe heat, and headache, vomiting, and irritates. Sometimes conscious, sometimes the patient is unconscious, and the patient also bleeding under the skin, vomiting blood bleeding, vomiting blood, nose bleeding, or the patient have spasm in the limbs, like in the hands or legs. The pulse may be deep and fast, or the pulse may be deep, sudden, and fast. The pulse also may be floating, big, and fast. In this formula, the dose of scald is quite high. It describes this we can use for 6 to 8 liang. 6 to 8 liang. Liang is the units in Qing dynasty. That's it's when we use the gram, one liang. It's about 37.5 grams. So 6 to 8 liang is about 180 to 300 grams. So that's the dose we can use for one formula. Also, because of this formula was described to treat the epidemic disease. Epidemic disease have the character of changing very fast. So this condition actually is a very severe condition. The patient have heat, severe heat in qi level, in xue level. The patient have severe heat in both qi level and xue level. So the patient will be like dry mouth, have severe fever, and irritate or unconscious because the heat go to pericardium, be unconscious. At the meantime, the patient will have some blood syndrome, such as nose bleeding or vomiting blood. These are the blood syndrome. So these symptoms indicate that the heat is severe in both qi and blood level. So this formula actually is the combination of 白虎汤, 黄连解毒汤, and 犀角地黄汤. 黄连解毒汤. These three formula we have discussed in the previous video. You see from the symptoms, the patient may be severe fever, may be thirsty, or even may be dry. So may have severe fever, thirsty, or sometimes have headache, severe headache. That's the symptoms of 白虎汤. The patient also may be unconscious, or the patient can have severe heat and irritate and can speak funny stuff. These are the heats go to pericardium is we use 犀角地黄汤 to clear the heat in the heart. Also have the blood syndromes. The blood syndromes such as the vomiting. Also we can use 犀角地黄汤 and 黄连解毒汤. So the patient may have like vomiting blood or nose bleeding. These are the blood syndrome we use 犀角地黄汤. And also the patient may have heat in like unconscious, and sometimes the patient may be unconscious and speak funny stuff. These are the heats in the heart, so we use 黄连解毒汤 to clear the heat in all three jaw, to clear the heat, especially the heat in the heart, in upper jaw. Also, when we use this formula for specific condition, we can adjust the dose, we can modify the dose according to the patient's symptoms. In the previous video, we have said that Chinese medicine is a mercy medicine. So for the heat, for severe heat, sometimes we clear the heat, we also guide the heat back to superficial level, or we guide the heat from urination to get a way for them to go out from the body. So in this formula, 清瘟败毒散, for this severe heat condition, we also use the same way of thinking, the same method. So you can see from this formula that except the ingredient to clear the heat, for the blood level, they also have like 鲜竹叶、连翘、桔梗、栀子. These are the flowers or leaves. These can guide the heat get out of the body from urination and to superficial level, such as 连翘、竹叶. These are the herbs for 胃 level or for superficial. And why we use 桔梗? 桔梗 is herbs can clear the phlegm. 桔梗 have another very important function, is it go to lung. It can open the lung. So it's very similar. If our body is like a container, when the lung will sink, the lung is like a lid. If a sealed container, sealed, the heat is not easy to go out, especially from urination. So we need to open the lung, we need to open the lid to get the water out from the container. That's why we use 桔梗. When you order tea in restaurant, you can see the very traditional teapot. On the teapot, on the lid, they have a small hole there. That hole actually, it's make it easier for you to pull the tea out, because as the tea pull out, the air can go in the pot. If you seal or you close the hole on the lid, the tea is not easy to pull out. That's why in this condition, we use 桔梗 to open the lung to make it easier for the urination to go out or the heat to go out. Because the lung on top of our body is like the lid of the teapot. If we open the lid a little bit, the water can go out easier. If the lid was sealed, or firmly sealed, the water will stay there. It's not easy to come out. That's why in this formula we use 桔梗 to open the lung. When we describe the symptoms of this formula, they have different pulse. The pulse might be deep, firm, and fast, floating, big, and fast, or deep and fast. Why in this formula they have these three very different pulse? The main reason of this different pulse is this different pulse can indicate the different condition of the heat or different heat level in different area. If the pulse is floating big and fast, it means the heat is still in superficial level. It means the heat in superficial level, and also the heat is not very severe. If the pulse becomes deep and fast, it means the temperature goes deeper in the body, so it becomes more severe. If the temperature becomes deep, firm, and fast, it means it can indicate that the temperature goes very deep in the body, and also it consumes the yin fluid. That's why the pulse becomes firm, because of lacking yin. That's why in this formula we use San20 to tonify yin. Also we use a large dose of San20 to tonify yin greatly. When the heat goes deep in the body, sometimes you can see the patient can have the cold symptoms in superficial, but these are contraries. So the heat is deep underneath. On superficial, we can see the cold symptoms. So sometimes we should not be confused, or we should not see the patient have the cold symptom on superficial. Then we say that the patient is in cold condition. Then we use the wrong herb. It makes the condition worse because underneath is the heat. How we know there's a heat there? That's from the pulse. No matter the pulse is floating, deep, or deep thumb, the pulse must be fast and powerful. So that's the key aspect of this kind of disease. In the next video, we're going to discuss the heat correction formula in specific organs, such as the heat in liver, the heat in the heart, the heat in the stomach. Thank you for watching our video today. For more information, you can visit our website. See you next time.